Today we will be doing a presentation on how to care for an indwelling catheter in the home. An indwelling catheter is a urinary catheter with a flexible plastic tube used to drain urine from the bladder when the person cannot urinate. The most common infections from using the urinary catheter is a urinary tract infection or a UTI. So it is very important to educate the patient and loved ones in the home on how to properly care for the catheter to avoid any further complications. Our case is about a 24-year-old woman named Miss Smith who is being discharged home with an indwelling catheter following gynecological surgery. She lives with her 28-year-old unsupportive boyfriend, and the nurse instructs Mrs. Smith in the correct technique for catheter care in the home.
Hi, I'm Miss Smith, and I'm the patient.
I'm the unsupportive boyfriend, Cortland. And I'll be the nurse today, Susan. Hello, Miss Smith. I'm Susan, and I'll be your nurse today.
Hi, Susan. How are you?
And who is this with you?
This is my boyfriend, Cortland.
Hello, Cortland. How are you doing today?
Hey, how you doing?
Okay. Is it alright if he stays in the room while I'm speaking to you about your catheter care?
Yes, it's fine.
Okay. So just to recap, you just had surgery and you're going to be having an indwelling catheter for a while. So I need you to take care of it so you don't have an infection later on or any other complications. So I'm going to explain to you what you need to do to care for your catheter. Is that okay?
That's fine.
And so I have a pamphlet for you, and in here you can find out what you can do to care for your catheter. There's also some links to some videos and websites that will further help you understand better.
Okay.
And let's begin. First and foremost, remember to always perform hand hygiene before and after handling the catheter. This will help with reducing the risk of infection. Also, you want to make sure that the bag is always below your waist.
Why do I need to keep the catheter bag below my waist?
This is to make sure that there's no backflow of urine. Also, when cleaning the catheter, use soap and water. Clean the catheter from where it enters your body and then down, away from your body, so that you don't put tension on it. You also need to check the tubing for cracks, clogs, and kinks. This is the tubing.
Okay. Can I take showers with the catheter?
Yeah, showers are fine. When cleaning the perineal area, remember to separate the labia and clean from front to back. Clean it twice a day, and make sure to dry with a towel and look for any signs for infection such as swelling and redness. And do not apply powders or lotions or ointments around the perineal area.
Okay.
Any questions before I continue?
No, you can go.
Okay. You will need to empty the bag regularly whenever it is half full and at bedtime. If your doctor has instructed you to measure the urine, make sure you do so before emptying the catheter. Before emptying, you make sure this is locked and you remove it, and then you empty it into the toilet. And when you're done, make sure you close it and reinsert it. You will need to empty the bag regularly whenever it is half full and at bedtime. If your doctor has instructed you to measure the amount of urine, do so before you empty the catheter into the toilet. Do not let the tubing or drain spout touch anything. This is the drain spout, so do not allow this to touch anything. After you empty the bag, wipe off any liquid on the end of the drain spout with an alcohol swab and put the drain spout back into its sleeve at the bottom. Okay, you also need to clean the drainage bag. So you need to drain any urine in the bag, put soap and water in the bag and close the valve. Swish it around and then empty it. Then fill it with 1 part vinegar and 3 parts water. Swish it around for a minute and let it sit for 30 minutes. Then empty the bag and let it air dry. Whenever you or someone else is cleaning it, you can always have another drainage bag attached. Also, Mr. Cortland, do you think you'd be able to assist Ms. Smith just in case she might need some help with her catheter care?
Cortland.
What? What's up?
I'm sure I could find help if I really did need help.
Okay, well then. Well, would you like to recap everything
Wait,
that
wait. I have a question. Can we still have sex?
Well, it is not recommended that you have sex due to the high risk of infection. So
does that mean a no?
yeah.
Love you.
Guys gotta know. I'm gonna wait outside.
You stormed out. That was very unacceptable.
It's okay, Miss Smith. So can you repeat back to me what I've explained to you?
Yes, I need to clean my catheter twice a day, clean it from the entering to the out. I need to always do hand hygiene.
Before and after.
Before and after.
Mhm.
I also need, it's okay for me to take showers, but I need to use soap and water. Don't use lotions, powders, or ointments. Did I cover it all? Did I miss something?
And don't forget, if you ever have any questions, to refer back to the pamphlet, or don't hesitate to call somebody.
Thank you.